So tell us a little bit about high blood pressure and how many people does it affect here in East Texas?
Well, East Texas is really a ground zero for hypertension. If you use census data from 2020, 2022, and you determine how many people are over the age of 18 in East Texas and the prevalence rates for hypertension, you would come up with numbers of 50 to 60,000 people in Smith County alone that potentially are hypertensive. And then probably somewhere on the order of 7,500 to 9,000 to 10,000 people who have what we call resistant hypertension, which is blood pressure more difficult to treat than the standard garden variety hypertension.
Yeah, so a ton of people.
A lot of people.
A lot of people. And so you just said a little bit about East Texas being kind of ground zero for it. Can you kind of explain to people what that means?
Well, it just means that there's a high prevalence, and there are lots of people who have the problem. Their access sometimes to medical care is somewhat limited. Their ability to obtain and take the medications, which we know help to reduce long-term complications, can be limited. The more medications they end up on, the actual ability to take those as you're supposed to take them really starts to drop off. So compliance is always an issue as well.
Yeah, for sure. And so what are some of the common causes of high blood pressure?
Most of the hypertension that we see around here, and everywhere for that matter, is what we call essential hypertension, which I tell patients essentially means we don't know what causes it. It's kind of garden variety high blood pressure. There are other secondary causes. For example, with obesity prevalence, sleep apnea is a highly common cause, contributing factor to hypertension. There are hormonal issues. There are people who have problems with their kidney arteries being potentially blocked and limiting blood flow, which then triggers a cascade which maintains hypertension and makes it more difficult to control.
For sure. And so in simple terms, can you tell us a little bit about renal, I'm not exactly sure how to say.
Denervation.
Yes, denervation procedure.
The standard therapy for hypertension is obviously medications. And so I've talked a little bit about some of the limitations of that. And we know that it doesn't take a lot of blood pressure improvement to cause a dramatic improvement in patients' outcomes. 5 millimeter drops in blood pressure can lead to 10% drops in overall cardiac event rates, and 10 millimeter drops will double that, basically. The problem is it's very hard to get that done with just medication. Sometimes people need a lot of medication, sometimes they can't take them, and there has never been really a procedure to kind of help with the medical management. Renal denervation basically is a procedure that interrupts the nerves which are connecting the brain and the kidneys. There's an intimate relationship with back and forth nerve traffic between both organs to maintain normal blood pressure, to adjust our blood volume, but certainly it's very active also in the development and maintenance of hypertension. Renal denervation is a procedure where we actually go inside the main kidney arteries with a catheter, which is a small tube that we place from the femoral artery in the groin. And once we get inside access to the artery, we have a catheter which delivers radiofrequency energy to the wall of the kidney arteries. Radiofrequency energy is basically heat. And this heat travels through the wall of the arteries to the fat that surrounds the renal arteries, which is exactly where the nerves live that go from the kidney to the brain and backwards. And the hope is, and it's been proven in a number of studies, that disrupting that network and that traffic back and forth of nerve impulses can give us the ability to better manage people's hypertension. It may not cure their hypertension, but it may make it a lot easier. And it does make it a lot easier to manage.
Yeah, for sure. You also mentioned something too, is kind of getting people to actually take the medication and do things of that is kind of a challenge too. Can you kind of talk about that?
Well, yeah, I mean, the medications, first they have to get the medications, which sometimes is a problem. Then they have to take them as prescribed, which is sometimes a problem. And then these medications all have side effects, like everything that we take. So people sometimes don't tolerate the side effects well. And then even sometimes one of the side effects is just that by controlling somebody's blood pressure, sometimes they will feel poorly because their set point is for a much higher blood pressure. And when you bring their pressure down to normal ranges, they get tired, they get dizzy, they get lightheaded. And they're unwilling to put up with that for a period of time to allow that to become their new normal, where they can become adjusted to that and actually become tolerant of that and not feel it anymore.
Yeah. Is there anything that we missed that you feel like people should know on this topic that we haven't discussed already, or that you would like to expand more on?
Well, I think that this is not something that's open for general population use right now. It's being studied on protocol. We're fortunate enough to have a research protocol that looks at this. It's called the Spiral Affirm trial, and we are across the country internationally looking for somewhere between 750 and 1,000 patients to enroll. It's pretty open access. You have to be over 18 years old. You have to have a blood pressure of greater than 140. And what we're looking for is what happens to people's blood pressure in the office over the first 6 months of the study. So this is not ready for prime time just yet. It's probably coming that way within the next year or so. We're expecting FDA approval on this particular catheter. But any involvement would have to be through a research protocol at this point.
Yeah. Anything else?
So this was not available in East Texas prior to y'all
No.
getting involved. So
No.
that's kind of cool too.
Yeah, it is, yeah.
Where would you have to go to get this done?
Well,
prior to
there
this?
are centers that have done this in major cities, Dallas, Houston, big academic centers generally. So we feel fortunate to be able to bring this locally.
Yeah. Other things?
So, and this might be a dumb question, but y'all do the procedure, then what happens? And are you just following up for several months, or are you good if you're the patient?
Well, the procedure's done on an outpatient basis. It does have some pain involved, so we have to sedate. Typically, patients go home the same day. And then since they're in a protocol, they're followed at specified periods of time, 3 months, 6 months, 9 months. They're followed for a total of 60 months after the procedure. And
Is it,
their blood pressures are monitored over that time frame.
But is it the hope once they get it done, then you should be good? Or
Well,
is that?
You will likely still need to take blood pressure medications at some point, but the thought is that if you're having trouble achieving a goal blood pressure, this on top of your baseline medication may be able to bring you to a goal level where you will achieve the benefit of reducing risk. So it's unlikely that you'd have this done. Maybe some people it happens to and you get off all your medications. If you're young enough, maybe that might happen, but probably you still need to be treated and followed closely afterwards.